When COVID first happened, I reached out to all of my patients, even if it wasn't a call month, just to see how they were doing, making sure they were okay. And as we got into the months of just being so isolated, I would kind of give my little patients a job. Do you have a group of girlfriends? Do you have their numbers? Did you call and check on them today? If they were someone who was active in a church or a club, I would say, did you call your pastor to get a couple numbers so that you can call and check on someone? Did someone call and check on you? And so giving them a job, I said, if you could find 5 people that it's your job during the week to call them, even if it's just a 10-minute chat, that kept them busy, and it kept helped other people, but it also helped them to feel like even though I'm at home and there's nothing I can do, I could still, make those calls and make sure that my friends are okay. If one of their barriers to their goal was to say, me and Debbie usually walk in the mall 3 times a week before we have lunch. That's how we get our exercise, but now we can't go anywhere. Are you still calling Debbie? Are y'all still able to have your little chats? Because as we still are, not as isolated as we were maybe in March or April, but still very isolated. I know that there's several patients, and even my nurses tell me now, that haven't left the house since March, and no one's coming to see them. Their family is leaving medications and groceries on the doorstep and going away before they're able to bring them in the house. Patients who are just so depressed because they can't see their grandchildren, because they're very scared of the transmission of the virus. And so talking to them about different ways, whether we teach, I've taught a few patients, I don't know if you know about Zoom, I don't know if you know about FaceTime, maybe that's something your family could help you with, maybe your grandchildren could come see you at the window, because at some point they missed their grandchildren so much, they were okay, like if I get the virus, I get the virus, I just want to see my family. And so going into the holidays, where it's already a time of increased depression and anxiety, and suicide rates for our patient demographic are climbing, and it's because everyone is alone, and it's already just a sad time of year. You start thinking about the people who are missing, or that you can't see your family if they're far off, and they've been dealing with that since March. So it's very important that we have this therapeutic listening, and that we're able to just ask the patient, well, what are you doing to stay grounded today? Are you still doing the knitting or the sewing that you like to do? Are you still painting? I had a patient, he loves to paint, and he worked really hard, and he was finally accepted to the art society where he lives. And that was a great way for him to just kind of paint his emotions during the whole ordeal. And I checked on him last month, and he's still doing really good. But just that we know that they have an outlet, even if it is at home. If they are safe to walk outside of the home, that they're at least going to the mailbox and back, so that they're getting some sunlight, just to combat the isolation.